Hey everybody, Christy Cap here. Let's talk about your hygiene department. I am a hygienist, and hygiene departments are one of my favorite things to look at because there's a lot of opportunity there, and I'm very passionate about prevention. I think it's the best medicine. I think we as a dental profession have a lot to offer when it comes to prevention, and our patients, I know, appreciate it, and it's the best thing for them. So the hygiene department is something I look at pretty quickly as well. Things I will look at, I will pull a day sheet for each hygienist and take a look and see what kind of services they are offering. Often, unfortunately, when I pull a day sheet for hygienists around the country, I will see procedures that basically only say radiographs and prophies. It's a very small number of procedures. They focus on a prophy mill, they clean their patients, they call you for an exam, and that's about it. And that's unfortunate because as hygienists, we have so much more to offer. I really believe that a lot of things can be taken off the doctor's plate and done in the hygiene department. It can be sealants, it can be whitening, it can be radiographs, like I said before, but so often radiograph policy isn't clear and defined, and you're missing opportunities and really just basic standard of care radiographs. Soft tissue management, how's that program going? 85 million Americans have some form of gingival disease. Are your hygienists checking for it often? Are they educating your patients about it? So I like to see a variety of procedures and dental codes on a day sheet, not just prophy and x-rays. It should be a lot more. And if I don't see any soft tissue management, that's an easy place to start because I feel passionate about providing the right therapeutic procedures and getting the patient to take ownership of their disease and getting the practice paid for everything the hygienist is doing. I don't know a hygienist out there that doesn't get all the calculus off. We love cleaning teeth, but often the practice doesn't get paid for it because they put on their superhero cape and just charge out a prophy, but they get all the calculus off and clean all the pockets really well. Well, that's kind of stealing from the practice. We're not coding it correctly, the patients aren't understanding their disease, and it's just not a win-win-win for the practice, the provider, and the patient. So, soft tissue management program, a variety of procedures, is one of the very first things I look at in the hygiene department to make sure that's happening. Have a great day. Opt in at DIYpracticemanagement.com to get updates and emails, and sign up for a course of DIY Practice Management Masterclass so you can become your own DIY practice management expert.